Hello there. Go ahead and take a seat for me. Thank you. Hi there. My name is Dr. V, and I will be taking care of you today. So I do have you in here for a full cranial nerve exam. Was there something that prompted you to make this appointment? Did you have any head injury, or are you experiencing loss of sensation anywhere? Okay, perfect. Alright, so I am just going to ask you a couple of quick questions before we begin. Of course, I do just need to confirm your name and date of birth. Okay. Perfect. Alright. And could you tell me the last time you went to the doctor's office? Okay. I see. Okay. And what was the last meal you ate today? Have you eaten today? Okay. Perfect. And when was the last time you had some water? Okay, perfect. So I am just going to take your vitals real quick. So I'm just going to put on my gloves and we'll get started. How are you doing today? Perfect. Do you have any plans for after this or? Okay. Wonderful. And how many hours of sleep a night do you say you're getting? What do you think? Okay. Because that can contribute to a lot of different things, so we always want to make sure we know how you're sleeping. And have you had any symptoms of illness over the last 2 weeks that you wanted to mention? Okay, so go ahead and just take a deep breath in for me. Good, and out. Good, okay. And just go ahead and take a deep breath in for me and out. Good, okay. Are you feeling any tightness or any sort of fogginess in your chest currently while you're breathing? Okay, perfect. And I am just going to take your pulse, so if you wouldn't mind just staying still for me. And I'm just going to Okay, perfect. I'll just take note of that. Okay. And could you please open your mouth very quickly for me? I'm just going to take a quick look inside your mouth. Say, ah. Okay. Okay, perfect. And are you experiencing any appetite changes? Are you eating more or less than you're used to? Feeling any itchiness or soreness inside your mouth or having any sort of hive symptoms? Okay. Thank you. The first test we're going to be doing is your sense of smell. So we're going to test how well you can pick up on specific types of scents. But first, what I'd like for you to do is just take a deep breath in through your nose and out through your mouth. Good, good, okay. And was that uncomfortable for you? Okay, perfect. So, what I have are these little sprays here. There are a few more down here, and I'm just going to spray these on to a little piece of paper, kind of like this, and then I'm just going to have you smell it. And what I'd like for you to do is just tell me anything that you can smell, any vague types of scents you can pick up on, or if you feel like you know exactly what it is, feel free to tell me, okay? There's no correct answer, so don't worry about getting it just right, okay? Perfect. So let's see, I think we'll probably start with this one. And I'll just shake up the solution, get it nice and mixed together. Okay, and then I'm just going to take this little piece of paper here and we'll just spray it right on there. Okay, so shake that out, and I'll just have you take a big inhale and exhale. Now, what kind of notes can you discern from that scent? Can you smell anything? Good. Okay. What are you picking up? A little sweet. Good. A little sharp. Citrus. Very good. Correct. Do you happen to have a guess at what type of citrus it is? Okay, that's okay. It was blood orange. So I'll go ahead and pick up this now and get this nice and mixed up. Okay. And I'll get another piece of paper here. And again, just spray nice on there. Shake it out just so you're not overtaken by it. We'll go ahead and take one big inhale and exhale. Good. One more inhale and exhale. Good. Now, what are you smelling? Okay, so it's a bit more, reminds you of food. Good. Okay. It's a bit more creamy. Reminds you of childhood. Okay. Okay. Do you have any idea what that could be? Okay. Vanilla. That's very good. That is why it probably reminds you of like childhood and little cookies and what other desserts. Yes, it's a very sweet scent too, right? Good. Okay. That was vanilla. Very good. Okay, we'll try just a couple more. So we'll spray this one and shake that out. Okay, go ahead and give that a smell. And one more inhale and exhale. Okay, good. Now what does that smell like to you? It's a little earthy. Good. Okay. Can you pick up any other notes about it? Okay, yeah, it reminds you of like gardening. That's good. That is actually like fresh, wet dirt scented, so that makes sense again. Okay, and lastly here, shake this up and get a new piece of paper here. So, last one, and that should be enough of that one. So, go ahead and take a nice inhale and exhale. And one more. Inhale and exhale. Good, 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 good. Okay, so what are you getting from this scent? Oh, perfect. You know exactly what it is? Okay, go ahead and tell me. Coffee. Perfect. Yes, that is a hard one to mistake, correct? Perfect. Well, you did very well. Good job. Go ahead and just take one big inhale and exhale for me. Just kind of clear out the senses. Okay. Now, what I want you to do, stay still for me. I am just going to hold one of your nostrils closed, and I'd like for you to breathe in and out a nice, big, hearty exhale through your nose. Okay, ready? In and out. Good, okay? And one more time. In and out. Good. Yeah, through your nose. Okay, perfect. Did you feel any sort of discomfort when I did that, or did one airway feel more clogged than the other? Okay, perfect. Thank you. So now we are going to move on to general sensation of your face. So I am going to get quite close and I'm just going to press on different parts of your face just to make sure there are no tender spots. So just let me know if there are any spots where I press where it feels a little uncomfortable or just a little bit tender, okay? So I'm just going to press, 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 and I'm just going to press down your neck as well. So I'm just going to press along your jawline here, pressing, press, 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 press. Good, and down here, press, 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 press. Good. Okay. So I'm just going to take this tool here. As you can see, one side of it is a little bit more pokey. It has comes to a little bit of an edge, and the other side is much more round and springy and just all over, not the same feeling. So one side is going to be labeled sharp and one side is going to be labeled dull, okay? And I'm just going to poke around your face, and I just want you to tell me whether the side I'm using is the sharp side or the dull side, okay? So go ahead and just tell me sharp or dull when you experience the sensation, okay? And good, dull, good, dull, good, dull, sharp, okay? Sharp, okay? Sharp, okay? Sharp, okay? Dull, okay? Dull, okay? Dull, okay? Dull, okay, interesting, and okay? Okay. Okay. Sharp, good, and sharp, good. Okay. So now what I want you to do is focus on whether or not the sensation you're feeling is hot or cold, okay? Hot or cold, or warm or cold. It probably won't be very, very hot. Okay. So again, keeping your eyes closed, focus on whether or not you're feeling hot or cold, warm or cold, okay? Cold, good. Warm, okay. Warm, okay. Warm, good. Cold, very good. Cold, okay. Cold. Warm, okay. Warm, good. Warm. Warm, good. Warm, okay, what about down here? Cold, good, and here? Cold, good, and here? Warm, very good. Okay, so now I'd like you to tell me where on your face you feel the sensation, okay? Nose, cheek, eye, what have you. Just let me know where you're feeling the sensation of pressing or being poked, okay? Good, okay, and nose, okay, and forehead, okay, chin, good, cheek, which one? Left, good, and right cheek, very good. How about right here? below your eye. Okay. And here. Your lip. Very good. Now, which direction do you feel the pressure going, down or up? Good. Okay. And which direction do you feel the pressure going, down or up? Okay. And which direction do you feel the pressure going, left or right? Good. In which direction do you feel the pressure going, left or right? Good. Up or down? Okay. And up or down? Good. And left or right? And left or right? Perfect. Okay. So now we do need to start looking into your eyes. I'm just going to start by just touching around your orbital bones and looking with the light here at your skin. So if you wouldn't mind just staying still for me. I'm just going to look at your skin here. Just making sure everything around your eyes is looking normal and healthy. Good. Okay. Perfect. So your skin is looking just fine. Now just go ahead and look at me, and I'm going to take a look at your pupil reaction. Good. Good. Okay. Good. Again, just looking at me, don't look at the light. Okay. Good. Good. Now, can you close your eyes for me and open them? Good. And close your eyes and open them. Good. And close your eyes and open them. Good. And close your eyes and open them. Good. Now, would you mind just looking up for me? Go ahead and just look up. Good. Okay. I'm just going to flash the light down here. Good. And here. Keep looking up. Good. Okay. And go ahead and look down. Look down, look down, look down. Good. Okay. Now look over here. Good. Look to the right. Yeah. Good. Okay. And look to the left. Look to the left over here. Good. Okay. Now can you look up and then to the left? Good. And look up and to the right. Good. And down and to the right. Good. And up and to the left. Yes, up and to the left. Perfect. Okay. Now, would you mind just looking at my finger here? Just look at my finger. Yeah, this one. Let's do this one. Go ahead and look at my finger and just follow it with your eyes. Please don't move your head at all. Just stay still. So just follow with your eyes as best as you can. Good. Just keep following my finger. Good. And just keep following it. Good. And which direction is it moving? Okay. And now. Good. And now. Okay. And now. Good. And now. Good. Now go ahead and just keep following my finger. Yeah, just follow my finger for me. Good. And follow my finger. Okay. And again, follow my finger. Perfect. Now follow the light. Good. And follow the light. Perfect. And follow the light. Good. And follow the light. Perfect. Very good job. Now, can you just look at my fingers back here? And my fingers back here. Good. Now, go ahead and just keep looking at my fingers. Good. I'm just checking for any eye wavering, seeing how well you can focus. Good. And let's see. Go ahead and look at my fingers right here. Good job. Perfect. So, this is going to be a little bit difficult, but hopefully it'll make sense. So, I'm going to check your peripheral vision. Go ahead and look at my nose. Okay, before you get too focused, I have two animals here. This one is a flamingo, right? You can see its little body, perfect. And this one is a cat. Perfect. So, look at my nose, and I'd like for you to tell me which animal has come into your vision, okay? Perfect. Okay, so which animal has come into your vision? Flamingo, okay. Good. Cat. Okay. Good. Flamingo, good. Cat, good. Okay. Good. Perfect. Good. Good. And lastly, good job. Perfect. So, now I am just going to use my fingers, and I'd like for you to just tell me when my fingers come back into your field of vision, okay? So just keep looking at my nose. Perfect. Just keep looking at my nose. Okay. And I would like for you to tell me when both pairs of fingers come back into your vision, okay? Not just one. Good. Okay. Good. Keep looking at my nose. Good. Good. Perfect. Okay. Good. Now again, just looking at my nose, let me know when my fingers leave your vision, okay? When you can't see them anymore. Okay? Good. Okay, so we'll start here. Perfect. Here. Okay. Okay, good. And we'll go down, down, down. Okay, here. And back up. Up, up, up. Just the fingers. Okay, very good. Now, again, can you just look at my nose and tell me how many fingers I'm holding up? Good. And here. Okay. And here. Okay. And here. Not quite. Okay. And how about now? Good. And now. Okay. And now. And now. And now. And now. And now. Good. Keep looking at my nose. How many fingers am I holding up all together? Good. And now? Okay. And how about now? Perfect. Very good job. Now I have this little dot here. As you can see, hopefully there is a little red dot here and a little green X here. Could you please look at the red dot? Look at the red dot right here. Just look at the red dot. Good. Okay. Now follow the red dot. Follow the red dot. Good. And follow the red dot. Follow the red dot. Good. Keep looking at the red dot only. Okay. Very good job. Good. Good, good, good. Okay. Now what I'd like for you to do is notice where the red dot is. Okay. Now close your eyes. And when you open them, I'd like for you to tell me if the red dot is farther or closer to you than before. Okay? Go ahead and open your eyes. Farther or closer? Good. Close your eyes. And now, farther or closer? Good. And now, Farther or closer? Good. And now farther or closer? Can you see it here? Good. So, can you see the little green X here? Good. Go ahead and just look at it for me. Good. And could you look at the red dot? Good. Back at the green X and the red dot. Okay. And look at the green X. Good. And the red dot. Okay. And go ahead and look at the green X and the red dot. Perfect. So next, what I need you to do is just take a glance back here. Can you read any of the letters on this line? This one right here. Good. Z, L. What about this one? Good. And what about this one? Okay. Can you read any of the letters on this line here? Okay. This letter here? Good. What about this one? Can you read this one? Okay. And the last one? Good. Okay. And can you read any letters down here? Okay. What about on this line? Good, okay. And what is this one? Okay, and the next? Perfect. Can you tell the difference between these two lines? Good, this one is red, and this line up here is green. Good job. Okay, now lastly, I have a couple of silly little pictures here, and I just want you to describe some things about them for me. So I'm just going to hold them up. Can you tell me what color this is? Good. And what about this? Okay. And can you tell me what this is? Good. And what about this? Good job. Now, can you tell me how many different colors you can discern from this? Good. And how many different colors can you discern from this? Pink, tan, white. Okay. And can you tell me what this is supposed to be? Okay. And this? Good. Okay. Now, how many different facial expressions can you see here? How do you think this little meatball is feeling? And this one? Good. And this one? Good. And what do you think this is? Good. And what about this? Okay, very good. That is a banana. Good. And just out of curiosity, do you have a favorite? And just out of curiosity, do you have a favorite? Perfect. Just wanted to make sure you saw the French fry. I realized I was covering the French fry. Okay, so we're gonna move on. How are your eyes feeling? Are they feeling tired or sore or dry? Okay. I'm just gonna press right here. Perfect. So now will be our taste test. I've got a few different flavors for you to taste, and it's just going to be sweet, sour, umami, or salty, okay? Sweet, sour, salty, or umami. Good. So these little colors do not mean anything about their flavor, so don't let that make you have any assumptions about it. So they look like markers, but they are in fact edible, okay? So go ahead and just stick your tongue out for me. I'm just going to right on your tongue. Go ahead and just taste that. Let me know what flavor you are getting from this. Good. Okay, yes, that is very salty, right? Perfect. Okay. And now got 2 left. We'll do this purple one next. So, I'm just going to dab this on your tongue. Go ahead and stick your tongue out. Good. There you go. And again, go ahead and just taste it for me. Let me know what flavor you're getting. Good. Okay, so it's kind of savory. Good. Okay, that's the umami flavor. Very good. Okay. And lastly, it's the blue, right? The blue one. So go ahead and stick out your tongue. And right on your tongue there. Okay. And again, just taste it. Good. Okay. And what flavor are you getting there? Perfect. Okay, that is the sour flavor. I can tell that you're getting a little bit puckered up there. Good. Okay. So you got all 3 of those right. Can you tell me which flavor we were missing? Sweet. Right. Good job. We did not give you sweet today. Perfect. Okay, I'm just going to take a quick note about the flavors here. And we will move on to our final grouping of tests, which will be for your hearing, okay? So first I am just going to take a quick look into your ears. So go ahead and just turn your head to this side real fast. And I am just going to take a quick look in your ear here. Okay. And are you having any ear pain? And would you say you're experiencing any hearing loss? Okay. Well, I don't see any excessive buildup of wax. You must have had your ears cleaned pretty recently because they're looking very squeaky clean. I'm just gonna go ahead and turn your head this direction for me. Good. Okay, and okay. Good. And again, I'm not seeing any sort of buildup. Okay. Perfect. Well, your ears are looking nice and clean. There is just a little bit of wax there at the outer section that I'll get for you, but it shouldn't be affecting your hearing at all. So let me just go in here and just get a little bit of earwax here. Okay. Perfect. And again on the other side, just okay. There we go. That looks better. Perfect. Okay. So we are just going to run through some hearing tests to check how you are perceiving sounds and how your hearing is doing, okay? Perfect. And remind me, are you having any sort of hearing issues that you wanted to bring up? Okay, perfect. Thank you. So the first thing that I would like for you to do is just repeat the words that I whisper into your ear, okay? Go ahead and just repeat the words that I whisper into your ear. Okay, so apple juice, apple juice, apple juice. Good. And Pop-Tart, Pop-Tart, Pop-Tart. Good. Okay. How about candlestick, 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 candlestick? Okay. And how about cupcake, 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 cupcake? Okay. And a couple more. Gorgeous, gorgeous, gorgeous. Perfect. Pickled peppers, Good job. Okay, so you are able to pick up on all the words that I whispered to you. Now I'm just going to have you close your eyes. Close those eyes for me. Good. And I'm going to just wiggle my fingers into your ears, and I just want you to tell me if you hear it on the left or on the right, okay? Perfect. All right, and here we go. Left. Right. Left. Left. Good. Right. 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 Left closer. Right closer. Both. Good. Good. Okay. So now what I want you to do is we're going to do the same test, but this time I'd like for you to try and discern which side of your ear is the sound further away, okay? Which side is the sound further away? So, which one is further away? Or, good, okay. Good job. And now which side is further away? Okay, and which side is further away? Good. Which side is further away? Can you tell which side is further away? That's a hard one, right? I'll do it one more time. Can you tell which one is further away? All right. The answer is the left, right? Okay. Correct. The left side. Good job. Okay. Lastly, I'd like for you to tell me what you think the sounds are. What's making the sound, okay? All right. And again, it doesn't have to be very specific. If you can just guess a material, or if you know exactly what it is, go ahead and guess for me, okay? Okay, so keep those eyes closed for me. Keep your eyes closed. What do you think this sound is? What do you think is making this sound? Makes a couple of different sounds, right? Good. This is the cover to a headphone. Cover to a headphone. It's nice and squishy and soft. Perfect. Okay. Next sound. What do you think this sound is? It makes a couple of different sounds. What do you think this sound is? Good, okay. So this is like a cardboard box. It has a couple of little wooden trinkets inside. Good job. Next up, what do you think this sound is? Can you tell what sound that is? What makes that sound? Good. These are little bells. There are little bells in here. Okay, just a couple more. What do you think makes this sound? Good. Don't mind the airplane, just the sound. Okay. It's a bit difficult, right? So it's this little bag, this little like plasticky fiber woven bag. Good. Okay, that one was hard. Okay, the last sound is Can you tell? Can you tell what this sound is? What makes this sound? Good job. They are little wooden popsicle sticks, the same ones we used earlier. Very good job. Let me just take a quick note here. But otherwise, I think that your senses and your cranial nerves are doing just fine. There are some things that we didn't do so much of today, like your lower cranial nerves, how your reflexes are, but as of what we've been able to determine through these tests, everything does look to be functioning normally, okay? Perfect. If you have any other questions, feel free to call or email, and you are more than welcome to schedule your next appointment up front with the receptionist, okay? Wonderful. You have a nice rest of your day, and thank you for stopping by.